What's up, Hoopers? Do you have pain underneath your kneecap or around your kneecap or right below it? You may have that pain when you jump, when you land, when you play, or after you play. You may have jumper's knee, or another word for patellar tendinopathy. If this sounds like you, tune in and we'll get after it right now. So what is jumper's knee? So jumper's knee is patellar tendinopathy. So quick anatomy lesson for you. So this is a knee right here, right knee specifically. You have your quad muscle up here and becomes your quad tendon. So your quad tendon attaches to your kneecap or patella, and then after that it changes from its name from quad to patella, and then the patellar tendon runs down and attaches at your tibial tubercle, or this little bony prominence here. So you have your quads up top, becomes your quad tendon, patella or kneecap, and then patellar tendon. So jumper's knee, specifically patellar tendinopathy, what it is a degenerative changes in the tendon itself. So the big difference that we gotta come up with here is tendinopathy versus tendinitis. So tendinitis is more of an inflammatory thing. So if you're having pain that recently came up in less than 4 weeks and you're able to rest and get back into playing, you more likely have patellar tendinitis. If you play and you rest and you wait for 4 weeks or whatever and your pain keeps coming back, it might be more of a tendinopathy issue. So the tendon actually gets thicker and resting won't quite do anything. So like when you rest and you go back, your pain keeps lingering. It might be more of a jumper's knee or patellar tendinopathy rather than an itis or an inflammatory response issue. All right, so now the question becomes, why did I get patellar tendinopathy or jumper's knee? So research has shown that usually it's when you increase activity or training load after inactivity or when you're not accustomed to it. So when your muscles are weak, the tendon takes more of a load and that tendon gets really stressed. So what muscles are weak is typically your glutes or your hip extensors, your quad muscle that attaches to this tendon. And then another one is decreased ankle flexibility. So like when your ankle can't move well, the forces get transmitted up and then your tendon takes more of a load again. So when you have weakness in those muscles as well as decreased flexibility, our mechanics change, so we tend to land stiffer. So those reasons are typically why you develop this issue in your knee. So if you want to learn more, stay tuned for our blog post that's coming out tomorrow, as well as the rest of the week for rehab, and a big announcement coming up later this week. Stay tuned, guys. It's Ball for Life.